are doing, is it the truth? Is it the truth? Is it the absolute or honest truth? Will it be beneficial? We mentioned that at the beginning of this course. So just be linking it. All this we are talking about also leads to that. And we said that what we are talking about ethics is meta ethics. What happens, how it happens to us, the reasons. So you'll be linking it and be getting to it, so you'll be getting clarity of what ethics, principles, and values are. So being open about your actions is good advice because it gives colleagues and your supervisor the opportunity to point out how your actions could be misconstrued by the clients or others. Remember, we have just said it again. Openness. Openness. This profession is very delicate. Even more delicate than the profession of medical doctors. Because a medical doctor will spend some few hours with the patient, but social workers will spend hours with the patient. A medical doctor may not get to know the houses or the residents of his patients. For a social worker, intervention may warrant that he gets to know the homes of his service user and those who are his support, who are in his family, those members of his religious body, those members of his community, and all those things like that. So you spend more time than a medical doctor will spend with a patient. And that's why we are saying that because of this, the fact that we are spending more time trying to help them, and because we are human beings, we need to guide against certain things and not close our eyes to certain things that happen within the ambit of our intervention engagement. We must always watch it. And we must also watch the backs of our colleagues to ensure that he or she or our organizations are doing the right thing. What are the reasons for maintaining clear boundaries? Number one, protection of the therapeutic process. The professional relationship is a fiduciary one. It is not a friendship, and even minor boundary transgression can give a mixed message. A boundary symbolizes limits of a professional transaction. So, boundary setting or maintaining of clear boundaries, like we said, gives us clarity of what we are doing. We are not the Lord of the game. And I tell you, like I tell you, those of us who have practiced before, some service user or their significant other will lead you on. They may even give you false information. If you are not careful, you fall into it, and then you are gone. So it makes our work a bit delicate. And we need to protect those whom we are serving. And we need to protect ourselves. Self-care is very important. Self-awareness is very important in the protection of the process of our engagement with the service. Yeah. Number two, protection of clients from being exploited. Clients are vulnerable, as we know, and social workers are entrusted to protect them from more harm. Somebody came with an injury, with pain, and we are supposed to give succor. We are supposed to make the person to forget his sorrow, to forget his pain, to forget his past, and let him move on. and then we come to add to the person's sorrow, add to the person's difficulties and challenges. What have we done to that person or to that client? So we have to ensure that we remove everything that constitutes a stumbling block from the ways of our clients. That is why clear boundaries setting is very important. It is to help them and to help ourselves and help our organization and to help the profession. So that when somebody helps a social worker, they know that you are meticulous, you are careful, you are truthful, you are reliable about your profession, and you are open about your engagement with them. Number 3, protection of social workers from liability. Protection of social workers from liability. Like we said, malpractices are also matters of litigation. Either your clients sue you, or their significant others sue you, or your colleague or your agency for infraction committed by you during your engagement with the service users. So it protects us as professionals from such liability. And some agencies now, they have malpractice or infraction insurance to guide against this matter of liability of social workers. And sometimes, even if our agency do not have such insurance for us, our social workers will need to be wise. And I think this is one area that social workers can go into. Social workers who have a background of economics or insurance especially. And we need to even work with some insurance companies for us to have some package to cover us from liabilities. From the time when misconduct will be committed by somebody, or somebody will say something that is ill against us, whereas we meant well or we meant good, and it results into litigation and court case and things like that. It is this insurance that, so that you don't use your last savings or your salary to be prosecuting a case. So the insurance company steps in and pay all the money that is required for you to go through that litigation. So it is two ways, like I said. One, whether your agency have that insurance policy, or you take up that insurance policy for yourself. Somebody talking? Okay. So, however, somebody is disturbing us. Can that person please mute our mic? Okay, thank you. Okay. Let's talk about boundary violation. Boundary violation, of course, when a social worker engage in a joint relationship with a client or colleague that is specific. Okay, we talked about that. Sorry about that. A key feature of boundary violation is a conflict of interest that harms clients or colleagues. What are ethical boundary violations? Ethics in social work are related to core values of service, social justice, the dignity. Jenny Corey, can you please mute your mic? Jenny Corey, mute your mic. Thank you. So we said ethics in social work are related to core values of services, social justice, the dignity of the individual, the importance of human relationship, integrity, and competence according to the Code of Ethics of the National Association of Social Workers. This Code of Ethics has been in place since 1996 to delineate the expectations for behaviors among social workers as a reference to determine what behavior is ethical in a given situation and as a set of standards to help assess whether a social worker has engaged in unethical conduct or not. I did mention to us that it will do you well to check our website and look for where the ethical principle of the profession is as stated by the Chartered Institute. What we are looking at is the National Association of Social Workers, which is an international body, not our own here in Nigeria, but the one we set for social workers in Nigeria. They are there. We are yet to produce into a pamphlet. Very soon we'll be producing into a pamphlet. It will be one of the items that will be given to you on induction. But before that one comes, you can go online and you can download it from there so that you also get familiar with what the Code of Ethics for social practice in Nigeria is. So ethics in social work are related to core values of service, like we said, social justice, dignity of the individual, importance of human relationship, integrity, and competence. Some of the basic ethical expectations of social workers include maintaining confidentiality, obtaining informed consent, and avoiding conflict of interest. Example of breaches in each of these cases will be like disclosing personal information about a client to the social worker's friends or relatives. Treating a patient without obtaining consent, or engaging with a service user without obtaining consent, and using the professional relationship for personal gain, extorting them, or to further the social work, religious, business, or social workers' religious, business, or political interests. Sexual contact with a patient is absolutely forbidden under any circumstances. You said that. So the individual, as it relates to colleagues, ethical So let's look at the ethical boundary violation as it relates to our colleagues. One, social workers are expected to act ethically towards colleagues as well as the patient or client or service user. The Code of Ethics says that a social worker should treat colleagues with respect and avoid giving unwarranted negative criticism or making demeaning comments about your colleagues. You have to protect your colleagues. It is like a cult. A cult member will protect his fellow cult member. If it is in the best interest of the patient or client, a social worker should consult with colleagues. We have said that often and often. No social worker should involve a client in a dispute with a professional colleague by asking for information or discussing the conflict with the service user. So sexual contact with students or trainees is forbidden as essential harassment of colleagues. Okay? Behavioral factors that may signal boundary violation. So let's look at some of those things that could mean a signal or a red flag of boundary violation. One, when social workers give the client his or her personal email, his personal cell or home address or phone number, or may even disclose it or our WhatsApp or Facebook account. Two, when social workers and clients communicate with each other via texting, via cell phone, on the worker's personal and or agency cell phone. Three, when social workers is warm natured and enjoy physical connectedness with clients, such as hugging or embracing upon contacts, kissing, rubbing the shoulder, hands, or face to provide comfort and support to the clients. Four, when social workers spend lengthy phone hours with the client during the workday or even at personal time. Five, when social workers dress provocatively on days when scheduled to see the client or clients will dress in moderation. When social workers spend an inordinate amount of time with clients, both scheduled and unscheduled visits, in comparison to other clients. Seven, when social workers talk frequently about the client and may even openly share how much he or she likes, fantasizes, or can relate to the client. Eight, when social workers may begin to spend frequent time with clients at various restaurants, movie theaters, or other public places outside of the client's home or even at workers' home under the guise of a client visit. It's a signal, red flag, where social workers freely shares and discusses his or her own personal experience with the client. It's a signal, where social workers spend his or her own personal funds to support clients' needs, particularly if agency will not pay for client needs, while worker chooses to assume cost on his or her own. Red flag, when social workers engaging in and use of drugs and or alcohol with the client. Red flag. And when co-workers begin to talk about the worker and in our relationship with specific clients. Red flag. So these are some of the red flags that could mean ethical boundary violation with either our colleagues or our clients. So lastly, let's look at uh, what the consequences of violations are to the social worker. Although the code of ethics is a guide rather than a law, ethical violations by social workers can result in professional sanctions. Sometimes a blatant violation is not necessarily grounds for legal action or sanction. For example, a social worker must violate the usual ethical standard of confidentiality to report child abuse or the potential for suicide. In this situation, the requirements of the law takes precedence over the social worker's ethical obligations. So, less personal free time with friends and family is another consequence of violation of boundaries, because you will not be able to have personal free time with your friends and your family. You always want to be closer to that client. So less satisfaction on the job. When you have violated boundaries, you will know it. And when you are sanctioned, it means that it will give you less satisfaction, less job. Today you are called and won. Tomorrow you are called and won. Tomorrow you are called and won. Is it only you? When the issue of fidelity comes in, it is you. When we talk about lack of trust, it is you. When we talk about flippancy, it is you. And all those things like that. So those are some of the consequences. And then co-workers' frustration. You'll be frustrated with yourself, you'll be frustrated with your co-workers. Then you always have burnt out, fatigue, and sometimes it may lead to loss of job or lead to loss of your license. It may also lead to loss of your professional identity. It may also lead to loss of your friends, your peers. It may lead to loss of your personal relationship. These are some of the consequences that violation of boundaries could mean to uh, service users, I mean to social workers, and it could demean our personality. It could rubbish our practice. It could also rubbish our integrity. So we do well by guarding and guiding ourselves and being on the right track of our practice. So in conclusion, social work professional ethics and accountability is crucial for maintaining public trust, ensuring the quality of social work services and intervention, and safeguarding the welfare and rights of our clients. So it is supported through various mechanisms, including professional supervision, peer review, ethical oversight bodies, and regulatory framework. This serves as uh, social or professional support for social workers who engage in the practice as we have been talking about for the past 3 or 4 weeks. And getting to this point, I want to thank you so much for always having rapt attention and always engaging with the lectures as we uh, discuss at every point. And I want to wrap it up by saying thank you so much for listening to this course, SWPCE 602, Professional Ethics and Accountability. Thank you and remain blessed.
Thank you, sir.
Thank you, sir. Thank you for the
Thank you,
lecture.
sir.
We
Very
really
much.
appreciate it.
Great feedback.
Really
Thank you,
appreciate you,
sir.
sir.
And God
Thank
bless
you,
you.
sir.
Bless you.
Thank you so much,
God
sir.
bless you,
Grateful.
sir.
God bless you.
Thank you.
Have a nice weekend,
We
sir.
are very grateful to you, sir.
Don't jump out of the class. There's one more thing we need to discuss, please.
Okay.
Okay,
Okay,
sir.
sir.
All
Yes,
right,
we need
sir.
to be, I think we need to be our brother's keeper, not so.
Yes, sir.
Yes.
Yes, sir.
Yes, so
Okay. I want to announce and seek our permission that our classmates on this diet from Ladoke Articular University of Technology, they are about 40 in this diet. They will be having their examination and going to be colliding with our exam period. You know, our exam was supposed to be is it 17 and 18?
I think 14 and 15.
14. It's supposed to be on the
14 and
14th
15.
and 15th.
June, Abi? Okay, June 14th and 15th.
15. Yes, sir.
Yes.
Okay, that's when we are supposed to have the exam, but their own movement from all the state of the nation where they belong to Ogbomoso, where their schools are, and the writing of their exam also falls within that period. So I want to beg us that we shift our exam to 21st and 22nd. If that goes down with us, we just move it for 1 week.
Okay.
You can allow
Okay,
them
by me.
It's
observe
okay
the
by us,
lecture
sir.
from their different location and write
Okay.
them
Okay,
down.
sir.
Oh, well, I'm good.
Okay.
It's okay.
Please repeat
If you
it
agree
again.
with that, if you
Thank you
agree
for
with
the
that,
consideration, sir.
Thank you. It's okay by us. You can send the new
Timetable.
timetable on the platform, sir.
Platform.
It's
it's okay.
supported.
We will do that.
So that people that are not on this yet will get the information firsthand.
All
Exactly.
right.
Exactly.
Thanks for the consideration, sir.
Okay.
Okay.
We'll do that.
Sure.
We'll post it on the platform shortly.
All right.
God bless you,
Have
sir.
a nice day, sir.
Is there any
I
question,
love
Thank you so much,
contribution,
sir.
confession? Is there any question, contributions, confession? If there is none, I want to believe that we are excellent students, and I pray that you pass your exams with flying colors.
Amen.
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 The group that have not submitted their seminar, please ensure you do that so that we can forward it to the viewers who are to engage in the paper.
All right, sir. I think tomorrow is
I hear
a
that some
deadline.
people still remains as it is. Some people are leaving their group to join other groups. If you miss your group, that is where your result will come from. Oh. That is where your result will be. If somebody in group 2 goes to group 10 and they're engaging with them there, that's the person's problem. Oh. I will just, if the name is on that paper of group 10, I will just cancel the name of that person so that the person does not have to stop in his own group. So let's be guided. And those who do not participate in the paper, your name, if it's not on that paper and you belong to that group, know that automatically that course is carried over because it's 60 marks, 20 marks for participation, and 20 marks for attendance, 100. Ditto other courses too. Attendance is 20 marks. So, okay?
Okay, sir. So the submission for the seminar is tomorrow, right? That's the deadline.
Yeah, tomorrow is the deadline. Yes, thank you. Tomorrow.
Okay, sir. By God's grace, we'll get ours tomorrow.
All right.
Thank you, sir.
Okay, thank you. Enjoy the remaining part of the weekend.
Thank you, sir. You have a pleasant
Hello, sir.
weekend.
Thank you, sir. Greet your family.
Hello, sir. I have a question, sir.
Okay, question. Okay.
My question is around past questions. Do we have access to past questions? Yes, sir.
We don't have past questions. Just read your materials.
Okay.
Okay, Mr. Salami.
Yes, sir. I want to ask that the shifting in the examination timetable, will it affect the presentation of the our group?
No, it won't affect.
All right, sir.
Area of concentration, no area of concentration, just read everywhere. Question will come from every slide.
Okay, sir.
Thank you, sir.
I can see your hand.
Yes, sir. About attendance, some of us are.
Sorry, can you speak a bit louder?
Okay, sir. I'm talking about attendance. Some of us, our names are not fully written on this Zoom thing. So I don't know how,
I
that will affect
can't hear
us.
you. The line is faint. I can't hear.
He's talking about the attendance that the names of some people are not clearly written or are not fully written.
No, it's the IT that takes attendance. You mean lecture attendance or the attendance in your group?
The lecture attendance.
Lecture attendance.
No, the IT takes lecture attendance.
Some of us, the same thing.
Do you understand?
Okay, sir.
Okay.
Okay. If you can lower your hand. You can lower your hand. Okay, thank you. How many is going to be our questions and time? You have 1 minute per questions. 60 questions. And you have 1 hour, 30 minutes. Actually, it's 1 hour. That's 60 minutes. 60 minutes, 1 minute for a question. But we're giving the grace of 30 minutes for submission and all the rackets. So 1 hour, 30 minutes maximum.
Okay, sir.
So
Well
each
noted.
question carry 1 point.
Hi. Hello.
The line is breaking.
Hello.
Breaking.
Okay, I think we need to wrap. Thank you very much. Good night.
No, àní bíbá yìí o. Àní táwọn ọkùnrin bíbá. Ó wà lọ́dọ̀ àwọn Akẹ́mi. Akẹ́mi wà lókè sómi.